Let us now see about the gastrointestinal symptoms. There are various symptoms associated with the function of gastrointestinal tract. We will see them one by one. Firstly, we will take up nausea and vomiting. Nausea and vomiting. Nausea is the feel of vomiting, and vomiting is very common, associated with different types of biochemical and hormonal changes that takes place in the body. So this chart shows the various mechanisms that can lead to nausea and vomiting in an individual. Nausea can occur due to raised intracranial pressure. Intracranial pressure is the pressure inside the head. Intracranial pressure can cause nausea and vomiting. And any type of cerebellar disease. Cerebellum is the part of the brain. Cerebellar disease can also induce nausea and vomiting because the vomiting center is present in the brain. So this can send impulse, or it can stimulate the vomiting center of the person, and thereby it can cause nausea and vomiting in the individual. This is the first reason. The second reason for the occurrence of nausea and vomiting could be due to pain. When there is intense pain, even sometimes when we have very intense headache, we vomit. So when there is an intense pain or there is an unpleasant sight, like we see an accident all on a sudden, or when there is a very abnormal smell, a bad smell, or when a person is very anxious or they are frightened to a very high degree, all these can cause problems, or it can send impulse to the cerebral cortex. It can affect the cerebral cortex, and the cerebral cortex, it will stimulate the vomiting center which is located in the brain, and it can lead to nausea as well as vomiting. Motion or position. So when we are moving or when we are in an abnormal position, these two can affect the vestibular nuclei which is present in the inner ear. It affects the vestibular nuclei, and this vestibular nuclei can stimulate the vomiting center located in the brain, leading to nausea and vomiting. Sometimes endogenous toxins produced in our body due to drugs, like for example opioids, or due to cytotoxic agents, or due to hypercalcemia. Hypercalcemia is when there is increased calcium in the blood. Uremia is a condition where there is increased urea in the blood, or due to liver failure. Presence of ketosis, what we call as ketones in the blood. Carcinomatosis, cancers, or radiotherapy. So these toxins or these biochemical compounds, they are carried in the blood or the cerebrospinal fluid. They affect the chemoreceptor trigger zone, and they in turn will stimulate the vomiting center. The other cause could be gastric irritation. Gastric irritation or irritation in the gastrointestinal tract. Gastric stasis. So abnormality in the gastrointestinal system. Gastroenteritis is inflammation of the gastrointestinal tract. Intestinal obstruction due to tumors, or constipation, or pharyngeal and esophageal stimuli. They can either lead to the release of emetogenic agents. Emetogenic agents are those chemicals that will cause vomiting. They will release the emetogenic agents that can affect the chemoreceptor trigger zone, and in turn will affect the vomiting center, or otherwise they can affect the vagal and sympathetic afferents. They are the the autonomic nervous system. They are part of the autonomic nervous system, and this will affect the vomiting center. So these are the various causes for the occurrence of nausea and vomiting. There are many causes of nausea and vomiting. and often there are more than one cause that is present in a patient. So we have seen a list of factors that can cause nausea and vomiting in the individual, and that nausea or vomiting in the individual can be due to a single cause or due to a combination of causes. And how do we manage nausea and vomiting? So we should first try to treat the cause if possible. We should identify what is the cause of nausea and vomiting, and you should treat the cause. For example, stopping the drug or changing the drug. For example, if it is caused because of a medicine, or reducing the dosage of the drug can be tried. Non-drug measures, if it is not because of a medicine, it can include relaxation. You have to relax the patient. If they are fearful or anxious, you can relax the patient, and psychotherapeutic techniques can be adopted. Acupuncture can be tried. Ginger can be given. We know that ginger can always relieve the patient from nausea as well as vomiting. Ginger in different forms can be given. And C-bands are nothing but they are elastic bands that can be worn in the hand, and they compress the acupressure points, and the C-bands will give some kind of relief for nausea and vomiting. In established nausea and vomiting, may need to use antiemetics. Antiemetics are the drugs that can control nausea and vomiting. So this cannot be given orally, because already the patient has nausea and vomiting, and if this drug is given orally, they are again going to vomit it, and therefore they have to be given via non-oral routes, which means they can be given in the form of an injection for initial control. Example, continuous subcutaneous injection via a syringe driver can be given, and they can also be given drug therapy. The cause that is frequently due to multiple reasons. It can be due to irritation or obstruction of the gastrointestinal tract. So irritation or obstruction to the gastrointestinal system can occur due to a cancer or due to chronic cough. Esophagitis is inflammation of the esophagus. Gastritis is inflammation of the stomach. It can occur due to peptic ulcers. Peptic ulcers can also cause nausea and vomiting. Gastric distension is when the contents of the stomach are retained, then it is called as gastric retention, or gastric compression can cause nausea or vomiting. When some other force compresses the stomach, that can also cause nausea and vomiting. Irritation or obstruction again, it can occur due to delayed gastric emptying. When the contents of the stomach moves slowly into the duodenum and then later into the small intestine, delayed gastric emptying. Bowel obstruction, when there is some obstruction in the bowel due to growth of a tumor or a cancer. Constipation. Constipation is the impaction of the large intestine with the fecal matter. Hepatitis is inflammation of the liver. Biliary obstruction. So when there is obstruction to the flow of bile. So the bile flows from the gallbladder. The gallbladder is located in the liver. When there is obstruction to the flow of bile, it can cause nausea and vomiting. Chemotherapy, radiotherapy, which are frequently given for the patients suffering from cancer, can also induce nausea and vomiting. The cause of nausea vomiting can be due to the chemoreceptor trigger zone, biochemical abnormality, hypercalcemia, liver failure, renal failure, and sepsis, presence of pathogens in the blood. Drugs like opioids or the antibiotics can also cause nausea and vomiting in the individuals. Through the vestibular system, it can, when the cause is through vestibular system, drugs such as aspirin, and through the cortical centers, the psychological factors, anxiety, when a patient sees a particular place, or when they smell a particular thing or taste something, it can induce vomiting. Conditioned vomiting. Conditioned vomiting is when they are in a particular place, or when they eat a particular food, they vomit. So that we call as the conditioned vomiting, and raised intracranial pressure. What can we do for such patients who are experiencing nausea and vomiting? The treatment options are: first, assess what is the cause and try to treat the cause. And the dietary measures could be, since they are vomiting, there will be loss of plenty of fluids from the body, and therefore liquid foods and soft foods can be given, and small meals can be given, and the patient should be advised to eat slowly. General measures is avoidance of noxious or suggestive smells and odors. So the patient should not be exposed to abnormal smells or abnormal sights or abnormal odors. And relaxation techniques can be taught to such patients. Use of antiemetics. Antiemetics are drugs that can prevent or give relief to nausea and vomiting. Drugs selected should be on the basis of presumed causative mechanism. You should first find out what is the cause and accordingly try to choose the drug for preventing vomiting. Comments before vomiting. These antiemetics should be given even before the vomiting starts, because once they start vomiting, it is difficult to give drug and to restrict the vomiting and nausea. Like if we know that a patient will, if a person will vomit when they take a trip through a bus, what we do even before they board the bus, you take the medicine and then you board the bus so that they don't vomit during that travel. Similarly here, the drug should be given even before the vomiting starts, and it should be given adequate dose. So the dose will be determined by the physician based upon the condition of the patient, and they can be given in combination. The antiemetic drugs can be given in combination if necessary, and it can be given by parenteral route if necessary. Parenteral route is giving them through the intravenous route. Intravenous route is administering the antiemetic drug through the vein. Use of antiemetics can be given if it is unresponsive. Assess for the psychological factors and then reassess if there are any missed physical causes, and try different types of antiemetics or combination. Nasogastric intubation and intravenous hydration should be avoided. Don't try to give tube feeding. The nasogastric intubation is passing a tube, a feeding tube through the nose into the through the throat into the esophagus through to the stomach. So that is nasogastric intubation. So that should be resorted only to the at the end. So immediately when the patient experiences nausea vomiting, try to avoid such procedures and try to avoid giving fluids intravenously as soon as nausea and vomiting starts. Only if the patient is dehydrated, you have to go in for the intravenous hydration. In patients whose symptoms can be controlled by other means, in the terminally ill patient. The next problem frequently encountered with respect to the gastrointestinal symptom is the intestinal obstruction. Intestinal obstruction in association with advanced cancer is often complex and difficult to control. So this intestinal obstruction means there is growth inside the gastrointestinal tract. It can be in any part of the gastrointestinal system. This will obstruct the food that enters the gastrointestinal tract. And if cancers are present, it is very difficult and it is also very complex to control. Yearly discussion with specialist palliative care team is recommended, because we have no control over the growth of the cancers or the tumor inside the gastrointestinal tract. It is both mechanical, that is, the obstruction will lead to intestinal narrowing, and it will also lead to functional deformities. That is, it will lead to it can cause poor motility in the intestine. The peristaltic movement, pendular movement, segmental movement, all these are associated with the function of the gastrointestinal system. And if the movement of the gastrointestinal tract is slowed, accordingly certain functions will be impaired. Causes for the obstruction. Most common is due to the primary tumors, tumors of the ovary and the colon, but may occur with almost any primary site, including breast and the lungs. So the cancer, when they are present in one part, they can progress to the other parts, and it can cause obstruction to the gastrointestinal tract. Tumor mass, when it is present inside the lumen is inside the gastrointestinal tract. Tumor on the peritoneal surface. So peritoneum is present in the abdominal cavity. So the tumor on the peritoneal surface can cause edema in the peritoneum. Edema in the peritoneum, we call it as the ascites or adhesions, and infiltration within the muscle cords, preventing normal peristalsis. So when the cancer cells, when they enter the muscles, and they can prevent the normal peristaltic movement. Peristaltic movement is the movement that occurs in the esophagus. Damage to the autonomic nerve plexus. So nerve plexus is the group of nerves by tumor infiltration of the mesentery. So the tumor, they affect the nervous system. Pancreatic carcinoma is the cancer of the pancreas, may cause gastric stasis. Gastric stasis is it restricts the gastric motility by unknown mechanism. Adhesions, radiation fibrosis, metabolic disturbance, constipation, and sepsis. All of these can cause obstruction in the intestinal tract. Management of the intestinal obstruction. This will depend upon the site of obstruction, and also it will depend upon whether the obstruction is complete or incomplete, or whether it is partial, and bowel motility and the patient's wish and the general condition. So the management is based upon various factors such as these. Consider surgery or stenting if there are clinical features to suggest a single site of obstruction. So you can opt for performing surgery in the patient if there is a single obstruction. If there is only one point where there is obstruction, and if that could be rectified, then you can go in for surgery. But if such obstruction are occurring in multiple places, then surgery is not going to improve the patient's condition. Or stenting. Stenting is putting a plastic or a metal tube where, in order to allow the passage of the material in the gastrointestinal tract. So this can be tried, and it will usually be based upon the patient's health condition and how the patient is progressing, and only if there is only one obstruction, these procedures can be tried. If inoperable, if a surgery cannot be performed, the aim will be to control the symptoms without the need for continuous drip and suck. So you have to manage the patient. Nasogastric intubation. Nasogastric intubation is passing a food pipe through the nose into the stomach, can be done, or percutaneous venting, gastrostomy. That is, you can introduce a feeding tube into the stomach directly, which is done percutaneously. This can be preferred by patients with gastroduodenal obstruction. When there is a obstruction in the duodenum, a gastrostomy can be done where drug treatment has been unsuccessful. Hydration. Hydration is the amount of water. Hydration with 1+ liter per day. IV. IV is intravenous or subcutaneous, may relieve the thirst of the patient, and also it will avoid the dry mouth, but may increase the vomit volume. So there are several things which we have to take into account while treating intestinal obstruction. Treat dry mouth because the patient is not able to consume liquids or fluids frequently. Treat the dry mouth. Treat the symptomatic gastroesophageal reflux. So the contents of the stomach coming into the esophagus, and the drug therapy can be done for such patients.